You know that you should probably go to physical therapy if you injure yourself after a car wreck or a fall, but there are so many other things physical therapy is great for that you may not have thought about. Kristi Olivotti from Aquatic Physical Therapy and Beyond joins me now with details. So physical therapy could be great for pregnant women or someone who had just had a baby?
It really is. If you think about it, pregnancy is so hard on the body to begin with.
Yes, it is.
As a lot of us know. And it's something where, you know, sometimes there's underlying conditions that we may have never treated beforehand, but once everything kicks in with pregnancy, the ligaments get lax, the core muscles diminish, posture changes. So there's a lot of things we can do utilizing the warm water pool and the appropriate physical therapy plan that can improve on these things. The posture, you can engage those core muscles in the pool. You can even work on stretches where it's so much more uncomfortable to even touch your toes outside the water, you know, when you are pregnant. So it's really, really beneficial. It not only helps get you through that time period that may be uncomfortable, but it's going to make you better off in the long run when you need, you know, you have the new demands of mommyhood.
Right. A lot of women have lower back pains and sciatica.
A lot. And we've seen some individuals that had, you know, really difficult conditions prior to becoming pregnant, and the bigger they got with pregnancy, they may have had excruciating sciatic pain that shot all the way down their leg. You know, those core muscles may have never regained from previous pregnancy. They may have never, you know, really been there full force to begin with. And if we can get them in the water, we can train them appropriately, we can still engage those muscles, we can minimize the pain, take the compression off the back, and then you've got all these tools to use, you know, as you work through postnatal.
Right.
And even then, you know, afterward, we've had a lot of success because, you know, you have new physical demands on you.
Right.
Once you've had the child, your posture changes, the way you're holding the baby, carrying that baby carrier.
Yes.
It's brutal.
Oh, everything changes.
You need to be strong to be able to do that. And so even making these little ergonomic changes and having the muscles to be able to do the work makes a big difference. And we can really help individuals with that.
Let's talk about fibromyalgia. There's a lot that you don't know about it, but one thing you do know is that it can really get in the way of getting a good night's rest.
It does. Well, and they have found there's a number of different medications that they do work with for individuals with fibromyalgia, but across the span, tests and research has indicated that those individuals never get that deep restorative sleep. So that sleep that we get during the night that helps repair our muscles and enable us to, you know, repair everything to move on the next day, they may never get that. So there's a couple things. The other thing that research has shown is that progressive monitored exercise does make a difference. So you've always got medication and you've got side effects of medication, but we know progressive exercise helps. So if we can do that and we can monitor these individuals appropriately, you do that in the pool, it feels better. And I don't know if you've spent an hour exercising in the pool, but you are tired.
Oh, yes. Oh, yes.
So,
panting tired.
Exactly. So even that night, you know, you just see this ability to relax that these individuals dealing with this chronic pain have a really difficult time attaining. And I will always ask them, you know, I may not have your pain under control the first week, but I guarantee that sleep will improve and that pain's going to follow right behind it.
Okay, this one really surprised me. You can help people who suffer from TMJ through physical therapy?
TMJ. And that's another, you know, I feel like it's another household name. People know about it, but typically it's the dentist that we go to, you know, for help with that. And the dentist makes all the difference in the world in making sure that your bite alignment is correct. If there's something that needs changed with a crown or the way that the teeth hit together, they change that. They oftentimes prescribe mouth guards, but a lot of times when we see people, they've tried all that and they still have the clenching, they have the pain, they have the popping, their jaw may even lock. Well, it's a ligament and it's a disc. Just like the knee, shoulder, you know, anything else that we work with, if we can improve the muscles through the neck, the jaw, the face, we can realign that disc appropriately, maybe make some modifications to their eating habits, their gum chewing, you know, things like that, and then help realign that disc, improve the muscles, improve the posture, can make a world of difference.
Wow. Enlightening. Kristi, thank you so much.
Thank you. You
can get in touch with Aquatic Physical Therapy at 919-870-4444 or on the web at aquaticpt.net.